Spotting ovarian cancer early. 12 warning signs every woman should know. Ovarian cancer is one of the deadliest forms of cancer in women. According to the American Cancer Society, it ranks fifth in cancer deaths among women, with an estimated 14,000 deaths in 2021 alone. One of the main reasons for this is that ovarian cancer often goes undetected until it reaches advanced stages. This is why it is crucial for women to be aware of the warning signs and symptoms of ovarian cancer. By recognizing these symptoms early on, women can increase their chances of survival and seek medical treatment as soon as possible. Today, we will discuss 12 symptoms that women should not ignore when it comes to ovarian cancer. By knowing these warning signs, we can all play a role in spotting ovarian cancer early and potentially saving lives. Just a friendly reminder, we are not medical professionals, and the information provided in this video should not be considered as medical advice. This video is intended for informational purposes only. Now let's begin. Number 1. Bloating that doesn't go away. Bloating is often brushed off as a minor issue, but when it's persistent and doesn't resolve with changes in diet or the passing of gas, it could signal something more serious like ovarian cancer. This symptom, characterized by a noticeable increase in abdominal size, can sometimes lead women to need a larger size in clothing. It is important not to overlook persistent bloating, especially if it's accompanied by other symptoms like changes in appetite or digestive issues. Unlike typical bloating that might come and go, bloating associated with ovarian cancer is constant and doesn't improve, making it a warning sign that shouldn't be ignored. Number 2. Difficulty eating or feeling full quickly. Ascites, the same fluid buildup that causes some ovarian cancer patients to feel bloated, may also result in a loss of appetite or feeling full more quickly. If your appetite changes or you feel unusually full after eating only a small amount, that's another red flag. You may find that you can consume just a small meal even if you're hungry before you start eating. The way patients describe it is, "I don't have much of an appetite. I take 2 bites and can't eat anymore." If you experience difficulty eating or feeling full quickly, it's important to consult with a healthcare professional. Number 3. Unexplained weight loss. If you've lost more than 5% of your body weight over the past 6 to 12 months without changes to your diet or exercise habits, it may be time to consult your physician. Nearly 40% of people first diagnosed with cancer report unexplained weight loss. Women with advanced ovarian cancer may also experience cachexia, a syndrome resulting in weight loss and muscle wasting. Cachexia can be caused by substances manufactured by tumors or an immune system response to the disease itself. Number 4. Pelvic or abdominal pain. Since period pain is common and most often considered normal, many women initially blame their menstrual cycles for the pelvic discomfort caused by ovarian cancer. Some blame digestive disturbances, noting heartburn, bloating, constipation, and gas. But it's important to know that pelvic pain in your abdomen, hip area, or lower back could be a sign of ovarian cancer. When tumors spread in the abdomen or pelvis, they can irritate tissues in your lower back. If pelvic discomfort is new to you or increases in intensity, consider scheduling an appointment with your gynecologist. It is very common for tumors growing in the pelvis to cause pain in the lower abdomen. This uncomfortable feeling is similar to period cramps. So many women assume these tummy troubles are harmless. Another symptom is pressure or pain in your abdomen or pelvis. The discomfort can be caused by fluid accumulating in the abdomen or pelvis, or by tumors that have spread to those areas. Some women describe it as feeling like period cramps, while others experience back pain or a pain in their side. Before we move on to the next sign, I want to remind you to hit the subscribe and like buttons if you haven't already. Your support is essential in helping us continue to create valuable content for you. Number 5. Changes in bowel habits. Gastrointestinal symptoms, such as changes in bowel habits, are often early indicators of ovarian cancer, but are easily dismissed as minor digestive disturbances. If you notice persistent changes in your bowel habits, including increased frequency or urgency, constipation, or diarrhea, it's essential not to overlook these signs. These symptoms can be particularly concerning if they occur in conjunction with bloating, abdominal pain, or changes in appetite. While these changes can also be symptoms of less serious conditions like irritable bowel syndrome, their persistence for 3 weeks or more warrants a discussion with your healthcare provider about ovarian cancer screening. Early detection is critical, and recognizing these subtle changes in your body could be a key step in diagnosing ovarian cancer at a more treatable stage. Number 6. Frequent urination or urgency. Your bladder and ovaries are close together. Tumors or swelling in or around your ovaries can cause urinary disturbances. Many women with ovarian cancer find they feel the urge to urinate more frequently in the weeks or months before their diagnosis. Some assume they have a urinary tract infection because the symptoms are similar. If you have ovarian cancer, you may notice increased urgency, burning pain with urination, bladder spasms, or difficulty emptying your bladder. Sometimes you might feel the urge to pee, but when you try, only a little trickle, or even nothing, may come out. An increased urge to urinate occurs when ovarian cancer cells have studded the outside of the bladder wall, or when ascites in the pelvis compresses the bladder, causing women to feel like they have to urinate more frequently. Number 7. Fatigue. Ordinarily, a little rest is all you should need to recover when you feel tired. If you find you have significantly less energy than usual or do not feel refreshed after an adequate amount of sleep, it's important to notify your healthcare provider. Scheduling an appointment is particularly important if constant fatigue is interfering with your ability to enjoy your usual activities. Although there are numerous potential causes of unrelenting fatigue, loss of energy and fatigue can be a sign of ovarian cancer. Number 8. Menstrual changes. Irregular menstrual cycles can sometimes serve as a precursor to more serious health issues, including ovarian cancer. Women with ovarian cancer have occasionally reported experiencing their periods with unusual frequency, sometimes more often than the typical monthly cycle, or noticing spotting between their regular periods. These changes, particularly in women who are not undergoing menopause and whose cycles were previously regular, warrant attention. Oral contraceptives usually regulate menstrual cycles, so unexpected alterations in your cycle while on birth control should prompt a consultation with a healthcare professional. For those who have gone through menopause, any form of vaginal bleeding is considered abnormal and should be immediately discussed with a doctor. These symptoms, while not exclusively indicative of ovarian cancer, underscore the importance of monitoring menstrual health and seeking medical advice for any noticeable changes. Number 9. Pain during intercourse. Experiencing discomfort or pain during intercourse can be distressing and may be a symptom not to be overlooked. While many conditions can cause pain during intercourse, it's important to consider it in the context of other symptoms that might indicate ovarian cancer. This type of pain is often a result of pressure or growths, such as tumors, on or near the ovaries that affect the surrounding tissues and organs. The discomfort can range from a dull ache to sharp pains and may occur during or after intercourse. If this pain is new, has become more intense, or is accompanied by any of the other warning signs mentioned, such as bloating, changes in bowel habits, or pelvic pain, it's crucial to discuss these symptoms with your healthcare provider. They can perform the necessary examinations and tests to determine the cause. Addressing these concerns early can aid in diagnosis and treatment, highlighting the importance of paying close attention to what your body is communicating, especially when symptoms converge to suggest a deeper issue. Number 10. Back pain. Back pain can often be brushed aside as a common discomfort experienced by many. However, it could be indicative of something more serious such as ovarian cancer. A significant number of women diagnosed with ovarian cancer have reported experiencing back pain that is new, persistent, and not attributable to any specific physical activities that might typically cause back strain. This type of pain can be a result of the cancer spreading and pressing on nerves or organs in the back, or a symptom of tumors growing in the pelvis. Paying attention to new back pain, especially when it's unrelenting and not caused by an obvious injury, is crucial. This symptom, coupled with other warning signs discussed, should prompt a conversation with a healthcare professional to rule out or confirm ovarian cancer as a cause. Number 11. Bleeding. Irregular bleeding is an unusual but potential sign of ovarian cancer, particularly in cases involving ovarian stromal tumors. These tumors are rare, representing just 1% of ovarian cancers, and have the unique trait of often producing estrogen. This hormone production can lead to bleeding reminiscent of menstrual periods, even in women who have gone through menopause. According to Dr. Brightman, because such bleeding is indicative of a small fraction of ovarian cancer cases, it does not rank as a primary symptom to be vigilant about. However, any unexpected bleeding should still prompt a discussion with a healthcare provider to explore its cause and ensure that it is not indicative of a more serious underlying condition. Number 12. Abdominal swelling with ascites. Abdominal swelling, often caused by ascites, a buildup of fluid in the abdomen, is a significant indicator of ovarian cancer. This swelling can lead to a rapid increase in waist size, presenting challenges in fitting into clothing comfortably. Dr. Connor notes an instance where a patient described this unexpected change as developing a beer belly. This symptom is not just about discomfort or appearance, it has been studied for its association with ovarian cancer. Research from the University of Washington revealed that patients with ovarian cancer were substantially more likely to experience increased abdominal size compared to those without the disease, with a striking 7.4-fold increase in likelihood. This finding underscores the importance of not dismissing sudden abdominal swelling, as it could be a pivotal sign of ovarian cancer requiring medical attention. Remember, we are not healthcare professionals. The information shared in this video is meant for educational purposes and is not intended as medical guidance. If you found this video interesting, I invite you to subscribe and check out our other videos on health and wellness.